I guess I don't understand. I don't understand what our Republican colleagues want to accomplish here. They talk about free market. They talk about the need to provide options and opportunities. I think that's exactly what an exchange does. So I don't quite understand what this is all about. I was the insurance commissioner, the elected insurance commissioner in California in 1991, and we set up an exchange. Unfortunately, Governor Wilson vetoed it. Otherwise, we'd have this exchange years ago. And a year and a half ago, the California legislature, with the signature of a Republican governor, Schwarzenegger, created an exchange based upon the Affordable Health Care Act. Actually, it was a year ago. And they want to put it into effect. The Republican proposal here on the floor would make it impossible for California to do what it wants to do, that is, set up a marketplace in which people have access to insurance. The notion being that by creating an exchange, you spread the risk over many, many different populations, so that, like a huge corporation, you have an opportunity as an individual purchaser or a small business to participate in a large pool and accept the lower rate of insurance. So what's this all about? What are you trying to accomplish here? Is it some ideology that you just simply can't stand the Affordable Health Care Act and you want to rip it apart piece by piece? Apparently so. And you just don't want to stop there. You're going after Medicare, a program that's been in effect for 42 years that provides a universal insurance policy to anyone over 65. You're going to terminate Medicare. What's that all about? And give it to an insurance company and not have an exchange? So what's an individual going to do when they're 65 and possessing all kinds of pre-existing conditions? Go without insurance? Be at the mercy of the insurance company? And by the way, you want to repeal all of the insurance reforms, all of the protections that individuals have in the Affordable Health Care Act. This doesn't make much sense to me. I don't understand what your goal is here, except maybe to have some political scorecard. You can say, yeah, we repealed the Affordable Health Care Act. Good for us. But what effect to the population of America? No exchanges? They're gone. No opportunity for small businesses to enjoy a large market, a large pool in which they can have a lower price? They're gone. Oh, I see. You can have an association health plan. I spent 8 years of my life chasing after association health plans that were frauds. They were out-and-out frauds, sold across state lines. Is that what you want? Apparently so. I don't get it. I don't understand what the goal is here. The Affordable Health Act establishes an exchange allowing individuals and small businesses to be part of a large pool, to have 4 different options on their insurance, and you want to do away with it. I don't get it. You want to do away with clinics in schools so the kids can have access to health care. I don't understand. You cut all the money out from the community clinics so that people have to go to the emergency rooms in a more expensive situation. What's this all about? I don't understand what the goal is that our Republican colleagues have in mind. The exchanges make sense. They create a marketplace for small businesses. Thank you very much, Mr. Speaker. The exchanges create a market, gentlemen and ladies. They create a market. It is a market-driven program in which competition occurs, competition between the insurance companies who have to offer it quality and price. You got a problem with competition? Apparently so. You want to do away with the exchange. Apparently what you really want to do is to hand the entire game over to the insurance companies, removing all of the controls, removing all of the necessity for them to compete, and apparently create some sort of an association plan so that the public can be ripped off. I yield back.
Gentleman's time has expired. Members are